I am Jack Cush with the Baylor Research Institute in Dallas, Texas. I want to talk to you today about disease activity and biologic use. Often we're confronted with the issue of patients who are afraid to use biologics or concerned because the TV tells them that there's an increased risk of infection. And certainly when any patient with rheumatoid arthritis or psoriatic arthritis is receiving a TNF inhibitor or other biologic has an infection, where many are quick to blame the drug. The question is it the drug or is it the disease that drives the risk of infection? This was analyzed by Jeff Curtis and colleagues in Abstract 561 from the ACR 2015 meeting. And specifically, they looked at two studies with the drug certolizumab, Cimzia, and specifically the Rapid 1 and Rapid 2 studies. There were 1,506 biologic naive patients entered into those trials. And in this retrospective analysis, they linked back the associations between disease activity and the risk of serious infection. So serious infection is a regulatory definition, an infection that's severe enough to put you in the hospital, get IV antibiotics. In their study, they actually found a high rate, and the highest rate was seen in those who had high disease activity. So the graphic on the right shows you that a high CDI was associated with the greatest risk of SIE, that risk being 8.87 per 100 patient years. 100 patients followed for a year, almost 9 of them would end up in the hospital on IV antibiotics from an infection if they had high disease activity as measured by a CDI. You can see with lesser degrees of activity, you have much lesser risk for infections. Overall, they found 201 patients who had an SIE, and you could actually equate that according to how much activity you have. So for instance, for every one box you check on a hack score, meaning a change of 0.125, there's a 27% reduction, or a 20% increased risk in serious infection. Likewise, for every 1 point increase in -28 CRP, there was a 16% increase in the risk of infection. So again, lower disease activity leads to less serious infections. And again, this is a message I try to drive home, that it's not the drugs as much as it is the disease and the comorbidity drives risk. An important lesson from this particular abstract. Tune in for more videos at TREC.